Now, in COVID-19, school closures were much more prevalent. Certainly, we had the ability in many settings to use computers and remote learning, um, but there were many settings that didn't have that ability. And I mean, like remote rural settings, for example. India and Uganda just reopened their schools. Actually, India hasn't, but Uganda just reopened their schools last week. But children truly had been out of school for almost 2 years there in rural Uganda. And North America, this is just an example of the global monitoring of school closures. You can see fully closed as the red line, and fully open is the blue. And there was really variability across our global spectrum of school openings. Western Europe was really aggressive about reopening schools, more, I think, than any other continent. And UNICEF has been talking a lot about school closures as looking out for children, and they really said that for the most vulnerable children worldwide, school closures have deprived them of one nutritious meal a day, or the violence or dysfunctional family settings, and have the entire pandemic really been urging school openings. You already know this, but in the country of the United States, there was just a gradation of how schools were open. Schools were frankly more open in states led by Republican governors than Democratic governors. California was actually the 50th out of 50 in terms of reopening its schools. They reopened in February 2021. I'm sorry, fall 2021. So that was actually after about 18 months of school closure. And they were close with Oregon, Maryland, Washington, and Hawaii. So I did start writing school opening articles and thinking about school openings after the vaccines were available. So my first article was February 2021, because before that, COVID-19 was more dangerous to adults. There's just simply no doubt. And I think it was really the vaccines that changed the equation. And I want to talk about vaccines in a minute. But before I get there, I know that you already know this, but there were multiple CDC-led and non-CDC-led studies across the country, even prior to vaccines, from Chicago, North Carolina, New York City, Wisconsin, Georgia, Utah, with really large samples of students and teachers, where in-school transmission, especially when there was mitigation procedures in play, which were masks, distancing to some level, and ventilation, but that was, there was variability in all those things. In-school transmission was low. And really it was that children and teachers got community transmission, but school became just like hospitals in a way, a place where people were coming, but there was an awareness, testing, mitigation, and school transmission stayed low. And really cases in schools throughout these studies were highly correlated with case rates in the community. That is true in our hospital settings as well. And social gatherings really were more likely to be associated with infection in school-age children than actually in the school environment itself. Though depending on what youth sports, there were outbreaks with youth sports. And then really in contrast to household settings, the lowest risk of transmission was among younger ages in school settings. And that may have to do with the ACE2 receptors, which take in the virus, being much lower in younger children. But it seemed like preschool was the lowest rate, at least in schools, and then primary, and then middle, and then high school, in terms of increasing rates of transmission